Governor Johnson, it's a pleasure discussing health freedom issues with you this evening. Can you tell us a little bit about your views on health freedom in the FDA?
Well, I really believe in free market. I think that the FDA really restricts our choices. And what are attorneys for? Wouldn't attorneys do a much better job of assigning and bringing about justice to drug companies that were actually egregious in what they sold to the public as safe? I think that the FDA really has acted as a good housekeeping seal of approval that has limited liability as opposed to actually assigning liability due. So we could do without an FDA. There's actually a way to not have an FDA, and that we would be a healthier country as a result. We'd have more choices.
You know, the Natural Solutions Foundation, as an interim measure, supports the idea of divesting the FDA of its food authority, because we feel that having food and drugs in the same federal bureaucracy is a prescription for disaster.
Well, and you know, nobody wants to say that we don't want to have safe food.
Exactly.
But that doesn't necessarily mean that the government is accomplishing that. And that's what I want to say is that as well-intentioned as the government is, are they really making food any healthier? Are we not with the FDA? Do we not still have incidents where people die because the food is contaminated? This is something that will go on for perpetuity, and companies that sell this food are liable and are held liable regardless of government interference.
And it's more than that. The FDA does strange things like claim that companies are not allowed to even put GMO-free labeling on food.
Well, and I'm in support of labeling. I have celiac disease. Gluten, for me, is poison. If I don't have food labeled, I can't eat.
Honest labeling.
Honest labeling, and then now you and I as consumers, we make choices. Should the government ban trans fats? No, they shouldn't ban trans fats, but they should require that trans fats prominently appears on labeling. And guess what? Trans fats will go away in our diet because people will not buy food with trans fats.
I wanted to ask, it seems to me the immediate both question and opportunity for you and for all of us is how do you unwind the disaster we're looking at?
What now?
A, how you unwind it, and B, what you replace it with.
In my estimation, it's a ship that's sailed. You know, the enrollment is just the tip of the iceberg. Well, it's the iceberg underneath that's going to hit the Titanic. It's not enrollment. I mean, they have till March 1st to do that. So to me, this is just going to be an unfolding, rip the side of the ship out and let's watch it sink. I mean, we're just going to watch it sink. It's just going to continue to unfold. So what I'm providing in the mix, uniquely providing in the mix, is what does free market really mean when it comes to healthcare? And trying to put a face on it. I would like to exercise my privilege here and just for a second talk about the FDA and what I've had to say about the FDA, which is, and so correct me if I'm wrong with what I say, but if there were no FDA, none whatsoever, I suggest to you that lawyers do a really good job of assigning liability and making those liable actually pay. And that what you have with the FDA is you have a good housekeeping seal of approval that limits liabilities for bad drugs as opposed to if they didn't exist.
There have been a series of cases recently that have done exactly that. Are basically saying if it's a government licensed medical device or drug, the rights to sue are very restricted. There's federal preemption. You can't sue in state courts if you're harmed. And as we know, properly prescribed medications are now the chief killer of Americans.
Up there with tobacco and alcohol.
And so this is a very serious problem. I'm very concerned with the way the clinics such as yours are going to be reacting to these new rules. I'm working with 3 groups of Amish people who are forming their own private associations to provide healthcare services. They are very much afraid that the plain people, if they go to the emergency room, will be asked, first question, are your Obamacare vaccinations up to date? And that, of course, is a very, very serious problem to a lot of people in this society. Freedom of choice. We're talking about the economics of the Affordable Care Act? What about the health freedom consequences of the Affordable Care Act? The FDA is already a tremendous burden on our freedom of choice. We discussed earlier how the FDA thinks that they can forbid GMO-free labeling. We're only seeing an increase in federal intervention. And I'm very concerned about that. I'm concerned about, it's almost what is not forbidden shall be mandatory. If instead of the market rationing health care, politicians ration health care, then if you're supposed to have that treatment, you must have that treatment. There are no choices left anymore.
Right.
And that's a very serious consequence.
So how would you respond to that?
One good thing to do would be to divest the FDA of food authority. At one time, back in the 1930s, it might have been logical to have food authority and drug authority in one agency because, of course, in those days, most drugs were food-derived. But today, with coal tar-derived drugs and other sources, there's really no direct link. And indeed, foods are the chief competitors for drugs. Today, under the Orphan Drug Act, physicians are allowed to prescribe medical foods. And so the possibilities of using foods for healing greatly increased. But one of our goals that we've set in the Natural Solutions Foundation is literally divesting the FDA of food authority. It's been done before. The DEA was cut out of the FDA, and the EPA was cut out of the FDA. And it should be possible to remove that bureaucracy from control of our food supply.
So let me simplify the question if I can, and that would be, somebody goes out and sells poison, and people die from the poison. I mean, what's the mechanism that somebody doesn't put poison on the shelf?
Well, there's every
rat poison and label it vitamin E.
We don't have an electronic safety administration, but every single one of these, if you buy it on a box, there'll be two marks, UL and CE. One of them is governmental, one's not. The CE is the European Union, their safety. That's governmental. But over here, it's a private coalition of industry dedicated to public safety, Underwriters Laboratories. Well, I mean, it's not entirely, these things don't explode that often.
If you could wave a magic wand at the FDA and change it to accommodate this issue, what would it be?
Yeah,
the FDA doesn't stop the crime. Half of the drugs that the FDA approves are within 5 years of approval either withdrawn from the marketplace due to serious side effects or have their indications.
Really? Say that again. Say that again.
Half of the drugs the FDA
New drugs,
the FDA approves. What it really means is that the general population is the final experimental subject, if you will.
The trouble with when you have a national Obamacare decision maker, they're going to say, well, this is what is the best for everybody. And there's no innovation, there's no learning, medicine needs to be something that is constantly learning.
Freedom of doctors is at risk.
Absolutely.
In the ACA.
Oh.
I think that the assumption that the FDA is the reason that we've had these advancements also is kind of a bold assumption. I mean, technology advances. We're getting better not because of the FDA necessarily. I think the industry has developed ways to track their medicines and know, like, oh, this batch was bad. We learned that after the fact. We can have recalls and such because they don't want to be sued. It's not necessarily just the FDA's intervention. Humanity has been very inventive, and medical technology is advancing at an awesome rate, and that's fantastic. But whether the FDA can mandate what we can or cannot do, that's the real freedom issue.
They're very good at preventing me from getting raw milk French cheeses and Scottish haggis.
Right.
There was someone who asked a question recently about what's the best way to undo the train wreck that is piling up.
Make provisions for a private free market alternative to that program, and just say, hey, if your program is better than what we can create in the free market, then let's duke it out, prove it.
And that's what we did with the post office.
Yep. Because right now a lot of us libertarians are, we need to get rid of this, we need to get rid of that. Well, why don't we start out by creating a better free market solution?
There's an example of that in history. Like that. It's, of course, Lysander Spooner again, one of our great libertarian heroes, who started the American Mail Company, which so successfully competed with the U.S. postal system that Congress passed the first of the postal monopoly laws, and that gave us a postal monopoly for well over 100 years. So we have to watch out. Libertarians have been offering alternatives to statism for a long time, and the usual response by the state is to increase the laws and increase the restrictions. We need a systemic approach
Yeah.
Right? I mean, all of this would work fine as long as there was a regulation of fraud. People,
Right.
companies that are making claims that are fraudulent shouldn't be allowed. So that way the public would, public makes their own decision. People make their own decisions, but you're basing a decision on information.
But that's not the way people work. It's the same fraud. It's the same, I can take more, I can give less. And until people get that out of their head and can get the idea out of their head that they can vote for I can take more and I can give less, we're not going anywhere.
That's right.
There ought to be a law that to stop being part of our language.
The problem was the cost of healthcare was too high for both the government and the rest of us.
Pre-existing condition. I mean, these are issues that I think could have been addressed much more
But
soon.
now as a member of the middle class who had health insurance, I can't afford my health insurance.
Crisis in the implementation of the ACA. There's going to be a crisis in the currency, the dollar. And those crises are coming at us rapidly, and libertarians should not allow those crises to get wasted. We have the only rational alternative to more status. Make sure that people like Governor Johnson are heard on these issues.
Well, I think it's going to create, at least in healthcare, it's going to create a two-tiered system like in many other countries where there's socialized medicine. There is the social program, and then there is the program for those who can pay for it.
Here's an outcome of President, this happened in Massachusetts, and this is going to be very real. And probably everybody at this table, unless you're on Medicare, you're going to make this analysis. In Massachusetts, everybody gamed the system. They paid the penalty. And because you were guaranteed coverage for injury or illness, you waited until you got injury or illness, and then you signed up. We talked about this right at the get-go. Because why not pay the penalty, and then
3.7%?
And then when you find out that you need a knee replacement or whatever it is that you need, you sign up for health insurance and you're given it.
This debt ceiling issue, which I apologize for harping on, everybody intuitively first thinks, no, I don't think we should raise the debt ceiling. I think we should be able to manage our bill. And then on the flip side, then people are told, no, if we do default, look at all these bad things that are going to happen. And they're going to say, oh, well, I still don't really know what default means. I still don't really know what the debt limit means, but I guess we can't do that. And I guess I was stupid if I said that, and you're stupid if you think that.
Yeah, we won't pay our bills and everything's going to collapse if we default.
Exactly. And
Just like everything collapsed during the sequester?
Yeah.
Yeah,
Just like there was fire in the streets?
Simply not true.
Mobs, the zombies, terrible.
I spent some time during the shutdown interacting, as I often do, with the Tea Party patriots on some of these issues. And I took a wonderful drawing of Murray Rothbard, his famous quote, if there were a button I could push to stop the government, I would bruise my thumb pushing it. And throw us in that briar patch, please. In this election, with the Libertarian getting such a strong showing, and most of his votes from the left and not from the right, seems to me shows a sea change. Indeed, there's a Gallup poll that shows that 60% of the American voter population now believes that we need a viable third party, and only 27% think that the so-called two-party system is working. That ratio changed in 2006. Prior to that, it had always been unthinking support for the two-party duopoly. You were all taught in public school the same thing. We have a two-party system. Why are we the only democracy on the planet with only two parties? I don't know. But anyway, we have a two-party system set up so that there's no real differences in policy. As Carol Quigley wrote a number of years ago in Tragedy and Hope, the purpose is to allow policies to remain unchanged while the voters can throw the rascals out. We need to build on the 60% of the electorate that's willing to make this change. I think it's time to do it. You don't be afraid anymore. Libertarians are going to get elected. That's what's going to happen.
Party or not, I think there's only one person who's giving voice to these issues, to talking about rational free market principles, who actually talking about, taking I think you called it a butter knife to government, and not necessarily scaring the suits and the straights out there, but